At 6 o'clock, I'm going to call the meeting to order. Can I please have everybody stand for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, tonight we're going to have Mark read the mission statement.
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Mark.
You're welcome.
Item number 3, adoption of the agenda. I'll take a motion.
So moved.
Support.
Motion by Antoinette, support by Wayne. Any discussion or addition or anything else? All in favor?
Aye.
Any opposed? Okay. Number 4, hearing of the public. Is there anyone from the public wishing to address this board? Going once. Going twice. There will be another opportunity at the end of the meeting. Item 5A, request to approve residential lease A. This has been approved by legal. I'll take a motion.
So moved.
Support.
Motion by Antoinette, support by Lori. TJ?
No.
No issues?
No.
Any questions for TJ? Okay, all in favor?
Aye.
Any opposed? Item 5B, request to approve a marketing campaign budget not to exceed $88,000. I'll take a motion.
So moved.
Support.
Motion by Donna, support by Lori. Tracy?
First, Kayla apologizes. She could not be here. She had an incident that occurred. It prevented her, but she will be at the next meeting to provide a update regarding the social media campaigns that have been progressing along. So in front of you, you have a PowerPoint on the front cover, just because I know you have more than one. It says 3rd and 4th quarter marketing campaigns. So obviously that's what we're going to talk about, is just the 3rd and 4th quarter. All 3rd and 4th quarter would be ending in our fiscal year, ending September 30th, just to give you the time frame that this is referencing. Essentially, we work with Airfoil already, and we are working on marketing materials. Just as a friendly reminder, we have a separate activity we're doing with AOT. Remember, because we got the grant, and I know I told you it was going to come before you as a separate item. Still waiting on it for it to be found in eGrams. As soon as it does, you will get that before you. So that is separate funding outside of this, just to be clear, because that actually does have a budget of about $30,000 for advertising and the creation of videos. So that is not in here. This is specifically for a targeted social media, so it's paid social media. We already have social media, just as a friendly reminder. We have LinkedIn, we have Instagram. We do technically have Twitter, but it's not really active. Or now, what is it called now? Forgive me, I'm so out of date.
X.
Thank you. And then we also do Facebook. We mostly use LinkedIn and Facebook. I know many of you are familiar with those and share the posts that we have, which we greatly appreciate. So this would be part of the social media campaign, is actually to purchase paid ads. We have done that in the past, and if it's helpful, that actually got us the most volume of individuals that the information was shared with. So we do think spending the amount of money on social media is well worth the efforts as far as the reach to the population that we are in charge of serving. One of the other asks in here is outdoor billboard options. It's a very small amount, but essentially, if you remember, we've done those in the past, and you have 3 different various options. You have large billboards that everybody thinks of, right? Like on the other side of the freeway. Then you also have what they call bulletins, which are a little bit smaller, and then you have a poster size. If it's helpful, we are still benefiting from, if you happen to be in Fraser, there is still a poster size on the side of the road that's never been removed from the last thing or whatever, so it's still out there. So sometimes when it's a lower traffic area, it will remain out there. So if you wanted to see one live in person, there's one in Fraser. The other ask of this makes up this budget is, we have not done this in the past, but this is actually to have some cable advertising. And it's a very limited capacity. That is one of the newer ways to get your word out there. But when we say cable, it's not traditional cable. It's things like Sling. It's all those alternative types of satellite. And again, I'm outdated by saying the word satellite. but the alternative types of solutions that people watch their media on. And if it's helpful, you'll see it's called Effect TV, and you'll see when you're purchasing it, you're actually purchasing all those different channels. So one of your slides has the large influx that we would be able to do. If you look at the page that has the chart on it, that actually breaks down what I just said and the very specific numbers. So when you look at the budget, it gives you per month, and then it gives you Google Display, how much we'd be spending on, how much we'd be spending on Google Search, how much we'd be spending on Facebook. And it also, if you notice, breaks it out per SUD versus mental health, because we do have two different budget line items, but we also want to make sure to distinguish. When we make sense, we advertise as a whole, but obviously there's a very targeted service that we want to make sure distinguish also directly related to SUD. So you'll notice it's technically a little bit less than 88,000. We just said up to 88,000 in case it ends up being off by a few $100s. If you wanted a summary, one of the last pages says project overview. So if you just said basically, what are we going to get by spending this $88,000? It's going to be one 60-minute brand video. We're going to get a 30-second countdown videos for the various things of crisis, substance use, veterans, youth, depression. It's going to be our main service areas. We're going to use those on social media, but we're also going to use those on our website. So right now, if you go and you have crisis services, then there would be a little website that would show the video for the 30 seconds telling you about crisis services. But again, it would be used in other venues. And then you also have some shots that they'll get, like various shots that we can, photography that we can use for other types of things. Just as a friendly reminder, we're purposely doing this type of activity because right now we're in a good place with funding. Futuristic if we don't. We're trying to really create some materials that are generic enough that 2 years from now we could still use. So that's been the efforts. And then if you notice on the page, it talks about the goal is to create more branding directly related to different types of media. And then it does give you a breakdown if you want very specifics on the videos. So of the 88,000, 36,000 is directly related to those videos. Do you guys do you want any more information, or do you have any questions at all? Yes, I'm sorry.
Yeah, I was just wondering, I don't see on here, maybe I'm missing it. What is there, and you might not know, maybe we need somebody else to come in, but how much it costs for the big screen, the 100% on the big screen. I know I've seen some advertising from some of the surrounding communities on my television. Do we know what that cost is? Because I see the delivery is the most delivery. So I'm just wondering if we know what that cost is.
We do. We just gave you the broad number, so I can follow up with you, Donna, and just send you the actual cost for
Okay,
those. Yes.
thank you.
Any other questions?
And can I get clarification just to make sure I'm following you, Donna? It's specifically for the branding of the cable television?
Yes.
Okay, great.
Go ahead, Mark.
Are we doing any radio ads? I see streaming audio. Is that radio?
It is. So,
Okay, I just want to make sure.
Yes.
Because I'm hearing another neighboring county all the time on the radio.
yes, we're actually behind the 8 ball when it comes to, in comparison to our competitors, and I'd say that in a loving way, competitors. We do need to be a little bit more aggressive in that. So you'll see if you notice, this is these 2 quarters we will be coming back to. We only wanted to do these 2 quarters because we all know we'd be in a different fiscal year, a different budget. So we will come back with you with some additional ask.
Go ahead, Phil.
Thanks, Dana. Tracy, once these ads are created, they're ours, correct? Airfoil helps us put them together, and then we get to keep them for, okay, thank you.
And we have been very clear with them the entire time. Our goal is to create, again, brand awareness, but with lots of messages that can be used the year after year after year. If you've been on our social media, you'll notice we have lots of themes that could be reused in the future. Yeah.
Any other questions for Tracy? Okay, I have a motion and support. All in favor?
Aye.
Any opposed? Item 5C, request to approve an amendment to our CMHSP agreement with MDHHS. This has been approved by legal. I'll take a motion.
So moved.
Support.
Motion by Donna, support by Lori. Tracy, looks like this is you again.
Yes, so this is an amendment. I just want to point out, there's really just two major changes. If you pay attention to your package, you have the signature page, kind of our standard part. Then you have, there is an updated compliance, as in our financial audit requirements. There was a small change too. And then you have there is a reporting section, but really the only change in the reporting section is they're changing the date of when we have to submit our ORR data, essentially. So if they make any change, as you guys know, we have to get an amendment. So again, the only two changes are those. It does not affect us financially or any other edits.
Okay, any questions for Tracy? Go ahead, Donna.
When we have these changes to the contract, I go through and I read the whole contract, Do you have to send the whole contract when we make these changes, or can you just send us the change? Because I went through and I read the whole contract, or can you just highlight the change? Because I read the whole contract and I still didn't know what the change was,
Thank you. I was thinking the
So,
exact
so,
same thing.
either can someone highlight the change or just send the change, because I read that whole entire contract, and at the end of it, I still didn't know what the change was.
So if it's helpful,
I was gonna jump in real quick. We have it listed on the board action request sheet, so it's not in the contract, but it's on that to help.
correct, help me.
saw that, and I
But
still
if it's
didn't
helpful,
find it.
Donna, believe it or not, that's not the full contract. The full contract, like, at 600 pages.
Oh,
So
okay.
we actually only gave you the two sections that changed. But we can definitely be more, yeah. If it's helpful, we can, give you the section, but then maybe circle or whatever. That, the recipient right ones was the easy one, right? Literally, we can go,
Right.
this is different. The other one's not quite as easy, but.
Okay.
Okay, any other questions? I have a motion and support. All in favor?
Aye.
Any opposed? Item 5D, request to approve releasing an RFP for outpatient services. I'll take a motion.
Support.
Motion by Nick, support by Phil. Christina, looks like this is you.
Any questions first? Just get off easy like TJ. So outpatient is those primary providers that provide that case management level of support. We did lose 2 providers in the past quarter. They chose to terminate their contracts, and so to ensure appropriate capacity in our network, we want to release an RFP so we can try to onboard more, ensure everyone is with the provider that they need. Any questions?
Any questions? I have a motion and support. All in favor?
Aye.
Any opposed? Okay, 5E, request to approve releasing an RFP for adult mobile crisis services.
So moved. Support.
Motion by Nick, support by Wayne. Christina, looks like this is you too.
So this one is to support our CCBHC efforts. So do we know that full acronym and what it means? Because I might not say it right, but does anyone need any more on that? So that's what this is on here for, is so that we are in compliance with those services and requirements. I'm not sure much more to say on that one other than that piece. We're going to look at other crisis services as we release that. What else do we want to incorporate in the RFP so that we can look at providers that are going to bid? Do they want to offer anything else?
Go ahead, Wayne. Or, I'm sorry, Nick. Go ahead, Nick.
Yeah, Christina, one of the things we've been trying to get to is where there's going to be some coordination with the police department on answering crisis calls, so that if it's a mental health, there's a mental health professional involved rather than just the police. Will this encompass that?
They would be able to call this team. Yes, this is going to be for adults only because we're already offering this for children. So they could call this team, and this team could be sent out into the community where that crisis is occurring to support that individual.
And will the police know that? I mean, we're going to contact the police to let them know if you've got a mental health crisis. You can either ask the team to come along or at least consult with them on how to deal with it.
Yeah, as soon as this is up and running, we would definitely coordinate with other community partners to make sure that everybody is aware of this, how to utilize it, who to call, hours of operation, and all of those pieces so that they know what the resource is.
And this is just on the MI adult side. This is not substance abuse crisis.
Correct, yeah.
It's both, it's
Oh,
both
is it
though,
both?
just to be clear, like they would need to be able to, in a substance use crisis, they would also be responding to those.
Oh, okay, so it can be both.
And just to be clear, this is to build off of. We do actually have crisis services, right? Like we have 24/7 services available through a number of means. This is just to further support what we already do. I just want to make sure you hear that would already exist.
Well, there's a movement going on to include a mental health professional with a police response team in a number of areas. We're not to that point yet, but at some point it would be nice to get there because you can solve a lot of problems with it. The police aren't necessary. We try to train them as much as we can, but they're not as obviously trained in dealing with mental health problems as they are. And you may need the police because there may be other reasons why you need the police as well, but both need to interact and coordinate to the extent we can. And I know some communities across the country are doing this fairly extensively, and I'd like to see us get to that point. So I think it would, one, in the long run, save a lot of money, certainly save a lot of grief and trouble for the people for the people being served.
Yeah, and if it's helpful, Nick, it does actually happen a little bit in Macomb County. So in Sterling Heights, they have 2 currently social workers, but they employ them. They currently have in their budget 2 additional ones. We've actually offered to say, hey, can we help you write grants? Can we help maybe pay for some of that? How can we partner? And at this time, they are reporting that they're self-sufficient and don't necessarily need that particular help. We've also met with Clinton Township, and they are trying to do something similar to that, and we also offered the same. They can be our employees, we can partner, we can partially pay, like how can we get there? And then the other thing is this is an expansion in the way that I have mentioned to you guys Active 911. It's an application. To your point, Nick, we're trying to get to a place where there is a crisis hub. So there's this dispatch that all communicates with each other, right? So if you're police, sometimes we're the ones that need to go out, but sometimes it's the police, sometimes it's both. So in Macomb, we're falling short in that particular area and we need to expand on it. This kind of further supports that, but so does the CSU and so does the engagement center, because it's great that we go out together, but if there's not a solution for the person, right, then
So,
now what?
so Christina, how much of this will be detailed in the RFP?
How much of the scope of service?
Yeah.
We're working on that now. We have included a lot of language about intensive crisis stabilization teams and how they operate. And then we're looking at how are we going to add the mobile component into this? Is there a pre-screening component as well? So we're going to be creative in how we put that, we're interested in hearing what providers are able to offer. And then we can build the program when we select the provider so that it might be very expansive. So we
So the
really have some
RFP is
flexibility.
not developed yet, you're in the process of developing. I'd like to be able to talk with you about that as we get closer to the actual language.
Okay, that'd be
And
great.
Nick, just if it's helpful, our design, I'm sure you guys know, but all across the country, they have all different approaches. Some use like a bachelor level, some use a master's degree level, and our children's mobile, which has been very, very successful for us in our other 24/7 operations, is to have a master level clinician and then a peer or a parent support partner. For that one, for obvious reasons, but the reason why we want it to be a master level clinician is on the spot. They can, as you know, Donna, they can correctly assess, they can diagnose, they can get them immediately to the right care of service. That goes back to what I was just stating a second ago. Helping someone de-escalate is great, right? But now what? So then you don't have to come back 2 days later, right? Because all we've done is de-escalate it. So our solution would be to provide that school scope of services. In a perfect solution, the CSU is open, the engagement center is open, so they can literally take them to their next most appropriate level of care.
Okay, any other questions? I have a motion and support. All in favor?
Aye.
Thanks, Christina. Item 5F, request to approve renewal of LinkedIn agreement. This has been approved by legal. I'll take a motion.
So move.
Motion by Antoinette, support by Lori. Looks like Gail is talking about this.
Hi, how are you?
Hi.
Good evening, everybody. Thanks for taking the time with me today. So in front of you, I think you guys all have the PowerPoint. We're looking to renew our 2025 LinkedIn account. So our current account will end June 28th, 2024, and the cost of the new contract is $15,280. with that, I provided some metrics in the PowerPoint that shows how many followers that we have. Currently, we're at 3,146 followers on our LinkedIn account. Part of that is due to our postings because we're bringing in traffic. So that's a great company, advertising, marketing, as well as job posting. We've, this past year, hired 18 direct hires through our LinkedIn posting, which is a reduced cost compared to the cost of like $20,000, $4,000 that the average cost is to hire somebody. We're at about $800, just about $800 to hire somebody through LinkedIn, which is fantastic and a very low cost to hire. The apply clicks and the jobs posted over time, we currently have 8 job openings on LinkedIn through this contract, and this will be the same that we're requesting for the next year. With that, we post between 5 to 12 a month. So with that, you'll see that those graphics show, up to 12. That, because we're interchanging our postings as we go along and what the need is, and then how many clicks we're getting for those postings. Our clicks compared to the competition are very high, so we are getting the traffic in to our LinkedIn page to see our postings, and ultimately it produces a lot of applications for our departments to look at and review, and then hopefully get them hired. The current contract is 6/27/23 to 6/27/24 with the 8 job slots, and then the job dashboard manager is complimentary. This is the same request for the upcoming year and that contract that we provided to you that we're requesting. And then I provided a breakdown from the last 3 years of the cost. So it's increased $1,960 last year. This increase this year is only $320, and it's really due to software improvements from LinkedIn. So any questions?
Anybody have any questions? Okay, I have a motion and support. All in favor?
Aye.
Any opposed? Okay, thanks, Gail.
Thank you so much.
Item 5G, request to approve Bradier subscription agreement and amendment. This has been approved by legal. I'll take a motion.
Support.
Motion by Lori, support by Antoinette. Jeff, you're already ready.
Yes. So yeah, we've been using Brainier since 2021. It replaced Relias due to some cost savings and some other things that we wanted to do. So currently, we're asking to do another 3-year contract with Brainier so we can continue doing the current trainings that we're doing and add more to it. And that was what part of the amendment was for, was to try to be able to increase our storage capacity, to be able to put more additional videos, PowerPoints, that kind of thing, make it live for our network and our direct hires. Any questions?
Anybody have any questions? Go ahead, Mark.
How many people use this every year?
We're right around 8,000 people. So that was last time I got a number was about 6 months ago, and it was right around 8,000 people. So, and part of that is because I think our contract goes to 10,000. Some of our contracted like AFC homes, some of their staff will leave and they don't take them off a roll, so we don't know to remove them out of the system. So we would have about 8,000 active people. Yep.
Any other questions? I have a motion and support. All in favor?
Aye.
Any opposed? Okay, thanks, Jeff. Item 5H, request to approve attendance at an out-of-state training session for Crossroads Clubhouse staff members.
So moved.
Motion by Wayne, support by Phil. Bruce, you're already ready too.
I'm sorry about that. Thank you for having me tonight. Hopefully, one of the things that you know about Crossroads Clubhouse and even myself is we don't like to stand flat-footed. We don't like to be behind the 8 ball, and we like to constantly look for ways to strengthen the clubhouse. Back in November, we got a grant from the Michigan Department of Health and Human Services to support Crossroads Clubhouse in colleague training. All of those colleague trainings are out of state. The priority is to send newer staff to that 2-week colleague training along with a clubhouse member, and then an administrator or somebody on the advisory board and someone on our foundation, or as a last resort, myself to go as the last week to create a action plan. The action plan then comes back to Crossroads Clubhouse for us to implement. Two things that I know that we need to improve on slightly is our transitional employment. And it's not that we don't have transitional employment, we actually have transitional employment, but I think that we could get better and stronger at providing the transitional employment services. Secondarily to that, I know that we have an opportunity to have a better community presence. And those are the two things that would be prioritized for the colleagues to go and learn, and then bring that information back to Crossroads Clubhouse to implement. So right now that we have an opportunity to go to Salt Lake City, Utah in August. This is perfect timing for us because, as you know, we're up for our reaccreditation through Clubhouse International in December. So it's a great opportunity and perfect timing for them to go and come back with a good action plan for us to implement and strengthen the clubhouse.
Any questions? Go ahead, Nick.
Nick?
Bruce, I don't know if this is technical, but on one of the forms, it says airfare needed, and it was checked no. You're not walking to something.
No, we're not walking in. If it is checked no, then that is an error. We will have to fly. My estimated cost total is right around $7,300, with $5,000 coming back to us from the Michigan Department of Health and Human Services.
It's on the county community mental health request to attend conference form. You just want to double check that.
So we'll correct that.
This part
Yeah,
though
we're
does
not
say
walking,
airfare down here. Did you see that part, Nick?
It says there, but on the form, it says airfare needed, and there's a check mark next to no. So I assume that was an error, but I just bring it to your.
Yeah. And I believe that I probably grossly underestimated the airfare. Just out of curiosity, I looked a couple weeks ago, and airfare is not, yeah.
If yes,
Wow.
please upload available airfare and a preferred seat to this
Really
form,
changing
so. I don't know whether you make the accommodations or somebody else at the county makes the actual reservations, but.
It works best if we do it.
Yeah.
Yeah, it works
That
best
doesn't
if we do that.
surprise me. No, I just wanted you to note that
Yeah,
the
thanks, Nick.
form may need to be fixed.
Appreciate it.
Okay, thanks, Nick. Any other questions? I have a motion and support. All in favor? Any opposed? Okay, thanks, Bruce. Item number 6, receive and file. We don't have anything. Item number 7, resolutions. We don't have anything. Item number 8A, interim CEO update.
Okay, so some of you know this, but at the state level, many of the budgets have been approved rather rapidly according to Phil. But because of that, I want to highlight some things. Now, there's some caveats to them, but essentially, and forgive me, I have to back up. I missed this earlier in a meeting too. If you don't know this, it's Nurses Week, so Jeff is the only nurse in here, so thank you, Jeff. I missed an earlier meeting, so please make sure to express our deepest appreciation. Back to hospital rates. In the state budget, there is a there is a proposal that by July 1st, we have to implement hospital tiered rates. So right now, there's a flat rate, right? But now we have to implement. The downfall of that, it's going to frustrate the hospitals, is PCE, our system, does not have the capabilities and will not by July 1st. And just to be fair, it's not just us. PCE is the statewide system used by the majority. So just know that the hospitals, we don't have clear communication. We don't have clear guidance. We don't have a technology in order for that solution by July 1st to be put in place. So I'm just drawing your attention to it, that we will, of course, implement if that is the rule and move forward. But I think there will be some frustrated hospitals. And to be fair, we will also be most likely challenged and frustrated with the situation. So in the state budget, one of the items is to define rates. So you guys know MAT, you know the MAT debate, right? So medicated assistant treatment programs, right? Well, they're now saying that autism in the legislature have defined rates. You have two different ones. The House, I believe, is like a range, but it's around 62. And when I say that, that's per hour, if that's helpful. And then you have the Senate, which I think is at 70. And again, they have a range. So when I say that, it's right around that figure, but there's a range within it. To explain the reasons why there is a concern about that. One, they're doing that statewide. You guys all know it costs very different to provide a service in the UP than it does in metropolitan Detroit. I did ask Tony, and he did give, according to our current rates, we're at like 62. Again, if you we pay 15-minute increments, but if you translate it into per hour. So it's not, it wouldn't necessarily be this large impact we think. We are very concerned about that because now there's a pattern. So instead of MDHHS fixing the problem, right, and addressing it there, the legislators, and I'm sure in a most positive manner, are trying to help the system by setting these rates. But that doesn't create competition, that doesn't create diversity among different regions within the state of Michigan. And we are actually in a decent area, but we are already, you heard last month us asked to put on an RFP for ABA services or autism services because we don't have enough. So we're in a much better position than some of the other regions, but there's other regions that are gonna say, great, you're making me do this, but I still can't provide it. Or there's other regions who are already overspent, so now you're making me pay more. And remember, those are the regions up north where 62 is not a going rate, if that's helpful. So we're drawing your attention to this because this is gonna affect our future reaction to the MAT situation we're in, but it also seems that it is becoming a pattern, which is not a helpful pattern for our system, even though their motive is starting in the right place. The next one is, there is, and I think some of you might know this, but in the budget, there's 8.3 million for peers in hospitals. That does not actually help us. That's actually for the hospitals to hire peers. The challenge with that is most likely the hospitals are going to just steal our peers. It's kind of like the school system with the social workers, right? On one token, we are supportive of it. It's going to expand the services to meet the community that we're in, but never at the loss of creating, just moving the problem from one group to the next group. So that's what we're fearful of. And also, hospitals have no current experience with this line of service. So they're not necessarily the experts. So we would have to jump in because ultimately it's going to affect the people that we serve. So there's going to be a learning curve, and are they going to use them in the way that they're originally designed to be used? And I've got some more good news, right? It's full of this today. Let's see. The next one is there's $30 million in Medicaid for the jail. Nick, you'd be interested in this? I guess the House passed it, but the Senate they put $100 kind of set aside to discuss it in the future. But the concept behind it is somebody who's in jail doesn't get Medicaid. We know that. We've talked about that in the past. Well, this would be some money to see set aside, so while you're in that, you could have a better transition of services and utilize the funding. So it's good in principle, but as of right now, again, the Senate just put like a placeholder to have future discussions. So it's not completely done. Just as a FYI, unfortunately, our Ron, our legal attorney, has resigned. He won't be with us by June, so we will continue to look for new. Yeah, but I don't want to end with the bad, because Ron was amazing and we're disappointed that we would be losing him. So I'll try to end with some good. If you don't know this already, it's a spoiler alert, but Bruce is one of the winners, and he is the winner of the Drita Jalaka Award. So he will be celebrated in 2 weeks, and I just wanted to make sure it's a full month of Bruce celebration. So congratulations.
Yay.
And that's all I have.
Okay, thank you, Tracy. Any questions for Tracy? Okay, a couple of reminders. We have a CMH Board Personnel Committee meeting Monday, May 20th at 12 p.m. Where, should we say where we're doing that? Where are we doing it? Okay, it's at the ISD.
Thank you.
I'll send out a reminder.
Thank you, Sandy. We have a CMH full board meeting Wednesday, May 22nd here at 6 p.m. Item number 9, provider comments. Okay, item number 10, hearing of the public. Is there anyone in the public wishing to address this board? Going once, going twice. Okay, just really quick before we adjourn, I want to say happy birthday, Sandy. Happy birthday.
Before we adjourn.
Yep, go ahead, Nick.
Before we adjourn, I just wanted to, on a sad note, and let people know that a longtime mental health advocate Lori O'Meara passed away earlier this week. Her services are tomorrow at the Call Funeral Home on Martin and Jefferson in the morning.
Thank you, Nick. Does anybody have anything else to add before we adjourn? Okay, I'll take a motion to adjourn.
Support.
Okay, motion by Wayne, support by Nick. All in favor? All right, we are adjourned. Thank you, everybody. Oh, wait. Now we're adjourned.